Welcome to our educational video on gastric polyps. We'll explore what these growths are, their causes, symptoms, diagnosis, and how they're treated. This information is for educational purposes only and shouldn't substitute professional medical advice. Gastric polyps are growths that develop on the lining of your stomach. The exact causes are complex and often multifactorial. Several factors contribute to their formation, including chronic inflammation of the stomach lining, often due to Helicobacter pylori infection. Long-term use of proton pump inhibitors, or PPIs, which are medications that reduce stomach acid production, has also been linked to an increased risk, particularly of fundic gland polyps. Genetic predisposition can also play a role, particularly in cases of familial adenomatous polyposis, or FAP. Other potential contributors include autoimmune atrophic gastritis and reactive gastropathy, often caused by bile reflux. Gastric polyps develop through different mechanisms depending on their type. Fundic gland polyps are often associated with proton pump inhibitor use and involve abnormal growth of fundic glands. Hyperplastic polyps, often linked to chronic inflammation, arise from excessive cell proliferation in response to injury or irritation. Adenomatous polyps, which carry the highest risk of becoming cancerous, involve dysplasia, or abnormal cell development, in the glandular lining. The overall process involves cellular changes, inflammation, and altered growth factor signaling, leading to the formation of a macroscopic polyp. Gastric polyps are relatively common, though the exact prevalence varies depending on the population and diagnostic methods used. Studies suggest that they are found in anywhere from 1% to 6% of upper endoscopies performed. The prevalence tends to increase with age. Certain populations may be at higher risk, including those with chronic H. pylori infection, individuals on long-term PPI therapy, and those with genetic syndromes like FAP. While most polyps are benign, their identification and management are important due to the potential, albeit small, risk of malignancy. Many gastric polyps are asymptomatic, meaning they don't cause any noticeable symptoms. They are often discovered incidentally during an upper endoscopy performed for other reasons. However, larger polyps or those located in certain areas of the stomach can cause symptoms. These may include abdominal pain, nausea, vomiting, bleeding, which can lead to anemia, and in rare cases, obstruction if the polyp is large enough to block the passage of food. The symptoms can be vague and nonspecific, highlighting the importance of diagnostic testing. The primary method for diagnosing gastric polyps is an upper endoscopy, also known as an esophagogastroduodenoscopy or EGD. This involves inserting a thin, flexible tube with a camera attached down the esophagus into the stomach and duodenum. This allows the physician to visualize the stomach lining and identify any polyps. During the endoscopy, biopsies are typically taken of the polyps. These tissue samples are then sent to a pathologist for microscopic examination to determine the type of polyp and to check for any signs of dysplasia or cancer. In some cases, additional imaging tests, such as a CT scan, may be ordered to assess the extent of the polyps and rule out other conditions. Gastric polyps are classified based on their histological features, which are determined by microscopic examination of the biopsy samples. The main types include fundic gland polyps, hyperplastic polyps, and adenomatous polyps. Fundic gland polyps are the most common type and are often associated with PPI use. Hyperplastic polyps are typically linked to chronic inflammation. Adenomatous polyps are the least common but carry the highest risk of dysplasia and progression to cancer. Other, less common types include inflammatory fibroid polyps and hamartomatous polyps, often seen in association with genetic syndromes. The treatment and management of gastric polyps depend on several factors, including the type of polyp, its size, and whether it shows any signs of dysplasia or cancer. Small, asymptomatic fundic gland polyps often require no treatment, but continued monitoring may be recommended, especially if the patient is on PPI therapy. Larger polyps, or those that are symptomatic or show signs of dysplasia, are typically removed during an endoscopy using techniques such as polypectomy or endoscopic mucosal resection. Eradication of H. pylori infection is crucial in individuals with hyperplastic polyps associated with this infection. For adenomatous polyps, complete removal is essential due to their malignant potential, and surveillance endoscopies are usually recommended to monitor for recurrence. Preventing gastric polyps involves addressing the underlying factors that contribute to their formation. This includes avoiding long-term unnecessary use of proton pump inhibitors. When PPIs are needed, using the lowest effective dose for the shortest duration possible is recommended. Eradication of Helicobacter pylori infection is also an important preventive measure. Lifestyle modifications, such as maintaining a healthy diet and avoiding excessive alcohol consumption, may also play a role. Regular screening endoscopies may be recommended for individuals at higher risk, such as those with a family history of gastric cancer or genetic syndromes. The prognosis for individuals with gastric polyps is generally good, especially when polyps are detected early and managed appropriately. Most gastric polyps are benign and do not pose a significant health risk. However, adenomatous polyps have the potential to develop into cancer, so complete removal and surveillance are crucial. Recent research is focused on improving the accuracy of endoscopic techniques for polyp detection and characterization. Advances in molecular diagnostics are also helping to identify individuals at higher risk of developing gastric cancer and tailoring screening and treatment strategies accordingly. Researchers are also exploring the role of novel therapies, such as targeted agents, in the management of advanced gastric polyps and cancer.